There is a condition that is difficult to detect, but it can be a medical emergency. It's called delirium, and there are two basic kinds, quiet and excited. They may look a lot like dementia, but they can be particularly hard to identify. If you are a caregiver, you need to know the signs of quiet or excited delirium and what to do about them. The first one we'll cover is quiet delirium. Here are some signs you should look for. Your loved one may not be thinking clearly or have trouble paying attention, not be aware of what's going on in the immediate surroundings, may seem out of touch, avoids making eye contact, might not know who you are or where they are, and may occasionally see or hear things that are not really there but seem real. These symptoms are different from your loved one's usual behaviors. Other symptoms can include slurred speech, answering very slowly, talking about things that don't make sense, and looking or appearing very sad. Let's see how this works with Frank and Doreen.
What are you watching, dear?
Why don't we shut this off until after you've had lunch?
The train should be pulling in soon.
What train, Frank?
I gotta get on the train. We're gonna see all the fish.
Here, why don't you try taking a bite of your sandwich? Frank, wake up and eat.
The fish and water.
Frank, what are you saying? Wake up! You need to take one of your pills. Here, take this.
Who are you? I wanted some tomatoes.
This isn't right. It's never been like this before.
This is quiet delirium. Your loved one suddenly just doesn't seem to respond to you in the usual way. It happens when a serious medical change occurs large enough to disrupt physical and mental functioning. As in this scenario, Frank is different because something has changed about his health. Doreen needs to contact their medical caregivers as soon as possible.
Yes, it's my husband, Frank. He's a patient there. He has dementia, but I've never seen him like this before. I don't know what to do. Please, can you help me?
Doreen did the right thing. The doctors and the rest of the medical team will work to determine what medical problem is causing Frank's behavior. In the meantime, she should stay calm and try to comfort him. Quiet delirium can appear unexpectedly. Now let's look at a more extreme and difficult aspect of delirium, and it can be dangerous. Notice the changes in Frank's behavior. The symptoms of excited delirium are more obvious than those of quiet delirium. They may include restlessness, attempts to get up and move around with no apparent purpose, aggressive or random behavior with various objects, and fearfulness. Like quiet delirium, however, they last longer than episodes of agitation and dementia. Other symptoms can include physical attacks on caregivers, such as punching and pinching, yelling, throwing objects, being disoriented, and not recognizing the caregiver. As with quiet delirium, your loved one will probably not be able to understand or explain why they are acting so differently. But you need to realize that the situation has changed radically. A person who is experiencing excited delirium needs professional medical care.
How you doing, honey? It's time for your pills. I brought you a glass of water.
Get out!
Oh, Frank!
Out of here!
Oh, no, that's all right. It's all right. Just stay down, Frank. Frank, you're hurting me. Frank, let go.
You must act quickly. Just as with quiet delirium, excited delirium is a medical emergency. That leaves it to you to take the only step possible.
Yes, I have a medical emergency here. My husband, Frank Taft, he's out of control. He needs to see a doctor right away. Well, he's throwing things. He grabbed my wrist. He's talking out of his head. I've never seen him like this before.
This is different than dementia. It comes on quickly, and the usual approaches don't work. Look for these symptoms: restlessness, attempts to get up, aggressive behavior, fearfulness, physical attacks on the caregiver, throwing objects, being disoriented, not recognizing the caregiver. There are warning signs that your loved one needs immediate and professional medical help. Remember, you did not cause it, and you cannot handle it by yourself.
Hello, I'm Dr. Barbara Kamholtz. I'm a geriatric psychiatrist in the VA. These videos were made for you, the caregiver. We'll be looking at dementia and delirium. As a caregiver, you play a particularly vital role in identifying delirium because you know your loved one best, and you can tell when they're just not right. We hope these videos will provide you with some tools to deal with these conditions.
If your loved one suffers from dementia, they can become agitated, and if so, this video is for you, the caregiver. You play a critical role in their well-being, so it's important for you to know how to handle difficult situations and when to call for help. Keep two things in mind as you watch this. One, you are not alone in facing the difficulties brought on by dementia with agitation. Many caregivers feel as frightened, helpless, and overwhelmed. And two, it is not your fault. You may feel angry or guilty. That's normal. You're only human. But you didn't cause the problem, and you're doing your best to cope with it. Meet Frank and Doreen. At first glance, you may think everything is fine, but it isn't. Frank suffers from dementia and can become agitated at times.
Here's your lunch, Frank.
Okay.
Go ahead, dear. Enjoy your lunch. I gave you a pear, too. As soon as you're finished, it'll be time for your bath.
Okay.
So far, there's nothing to be worried about, right? You've been through this routine before. But this time, something is different. Frank exhibits signs you need to be aware of.
Frank, you haven't touched your lunch.
I already ate.
No, you didn't. You didn't eat a thing. Now, I want you
Leave me alone.
Frank, you have to eat.
I've eaten.
Frank, your pills. You haven't taken your pills.
Go away! Those aren't my pills! What are you trying to do to me?
You have got to take your pills now and eat your lunch. What is the matter with
I'm
you?
leaving.
What?
Get in the car! Where's the car?
No, you don't. You are going to take these pills, you are going to eat your lunch, and you are going to take your bath. What is the matter with you?
You see what happened. Frank suddenly became agitated, and the reasons were unclear. This can be extremely upsetting and frustrating. Most important is to try to understand what caused the behavior. Our loved ones with dementia can't often explain it, but most of the time this behavior is related to medical problems like pain or difficulty breathing, changes in the environment such as meeting a new person, being served dinner in a different place, or hearing arguments at home, being thirsty or hungry. Psychological problems like being afraid, being nervous, being sad or depressed, or hearing or seeing things that are not real. Many of these may seem minor to the caregiver, but patients with dementia have little ability to adapt to anything that is new or stressful. It helps to try to think back to what was happening right before your loved one got agitated. Are there any clues? Ways to approach our loved ones who are upset include remaining calm yourself, providing reassurance and explanations about what is going on around the veteran, and communicating clearly with simple sentences. Let's see what happens when Doreen responds with a softer approach, using some of these techniques. She reduces the choices so that Frank can follow one idea or instruction at a time. She asks questions that require only a simple answer, and she tries her best to stay positive.
I like you in this shirt, Frank. It's a good color on you. You haven't eaten your lunch, dear.
I already ate.
Well, Let's just move this over here in case you get hungry later on.
I'm not hungry. I already ate.
Honey, what about your pills? Can I help you with those?
Those aren't my pills. Leave me alone.
Maybe they'd be easier to take with a glass of water. These are for your high blood pressure and for pain. They all make you feel better.
I don't want any pills. Whose pills are they?
Tell you what, Frank, it's time for me to take my pills too. Why don't we take them together, okay?
Your pills too?
Yes. And then you can get cleaned up. Our grandson Johnny is coming. Do you want to take a shower or a bath today, Frank?
Yes, Johnny. I'll take a bath.
I'll run your bath water. And I'll let you test it first just to make sure it's the way you want it.
You can see how Doreen acted differently. She didn't argue with Frank, she gave him some easy choices and just asked simple questions. Doreen made her affection for him clear and allowed Frank to be involved in some of the decisions. She didn't confront him about the lunch or the pills or the bath. These approaches can be reassuring to both the person suffering with dementia and the caregiver, making life more pleasant for both.